Hi guys, so we're here finally getting this video to you on doing jaw. So we have Mitzi here, so she's got a great jaw here, but we need to do some little bit of rejuvenation. So I'm going to map out where we need to focus on, where we're going to put the injections, and what to look out for. So the first thing you want to do is find where the angle is of the mandible, and that's, she's got a really lateral one here, but I want to emphasize this because if you look here, you see her jowls here, and she has got the zygomatic ligament pulling down here, so it kind of separates from her jowl and the ligament. So by extending back her jaw and putting more volume pretty much in like this little triangle area here, it's going to pull this back without making this look heavier. There's a couple areas that we want to be concerned with and where we don't want to inject. The number one place we want to know is where the carotid is. So the internal carotid actually comes up in front of the masseters. So if you can't figure this out, then bite down, Mitzi. So here's her masseter. So I'm assuming that's her masseter. It's going to be around this. But what I'm also going to do, relax, is feel for the notch. You're going to feel a notch where that all comes out of, and sure enough, it's coming out right there. So it normally comes just inferior to, or I should say medial to that masseter. So mark that because you do not want to inject into that. That is where a lot of vessels come out, your nerves originate from there, and you want to avoid it. The other thing is that we do not want to emphasize on the jowl. So I'm going to build this up and probably depot to the periosteum here. Make sure that you stay on the anterior surface of the periosteum. And then I'm going to do a cannula, and I'm going to make my entry point right through the jowl. So that my emphasis then is going to be to extend and put filler laterally, and then come this way and fill this way. So let's go ahead and get started here. Okay. So here's my angle. My angle comes all the way here. This can be a little painful for the patient, so make sure that the patient has been numbed and warn them before you stick the needle in. Mitzi here, we have Pronox that we use, so she's ready to go with this. So I'm going to go down to the periosteum to the anterior border of the mandible, and make sure you hit the bone. I aspirate, and then I inject. Make sure you keep a finger on the patient's face, so if they move, you are not going to move the needle out. Okay, so you can actually see with just one injection how she's starting to get some definition back here. Now I'm going to come right here and do the same thing on the mandible. I'm aspirating. This is Restylane Lift that I'm using right now. And the reason why I'm using lift is that I want projection and support of that jaw. If I wanted just a little bit and someone that didn't need a lot of projection, I might choose to do Restylane Define. Okay, I'm going to come, this was my little notch. I'm going to come right here and do the same thing. Aspirating and then down. So one of the things that I do like doing for her is because she does have such a jowl here, I'm going to go ahead and put a cannula here and kind of volumize the submalar area back here to get more lifting of her lateral neck and also this jaw. Do you see how I pull this up? How much tighter this area gets. So we're not really focusing just on this. I don't want to make her cheekbone any higher because she is, you know, she's got great structure and she's already filled, but we do have this loss back here in the submalar area, so how do we get that to pull up? So I'm going to switch over now to a cannula, if you want to look over here. So here I've got my setup already. I've got my other lift going. This is a 25 1.5, and here is a 22 2 inch. And I'm gonna have this out just for my define, but I'm going to the 25 1.5 for this. Now, just for comfort's sake, I'm gonna numb her up a little bit. So I'm gonna go back where I was, because she should have a little bit of numbing there from the lift that I had put in. Now, like I showed y'all before, you want to put that the needle in at the depth that you want to volumize. Wherever you want that depth of that cannula is the same depth that you put the needle. Okay, so I'm going to come in here. She's so healthy that she just clots off right away. Are you okay? Mm-hmm. The switching off has to be kind of quick. Okay, so there's my cannula. That's my depth. Why do I want to stay more superficial and not go too deep? It's because your parotid gland is right beneath this. So the area should not be going too deep, because you do not want to penetrate through the parotid gland. So lift your chin up for me. So this is a really good key area to get to volumize, to pull up that lateral neck, and to pull up the jowls, the marionettes, without getting too much volume and making her face look too round. Now you see, even with the cannula, I'm pulling back and aspirating. That's really important. I can't stress enough on how important it is to make sure you're aspirating. There's still a lot of controversy about doing this, and do you really have to do it? Well, my idea is, as long as I'm going to keep my patient safe, I'm going to aspirate. So it only takes a second to do, but it makes, what if you don't aspirate, then what are you going to do? So you see, I'm still superficial. You can't see the hub, but you can see how I'm still in the mid dermis here. So I'm pulling back. If you have doubt or you're not sure if you're pulling back blood, just put a gauze up underneath it so you can actually see the hub. The hub is where you need to look. Don't look in the syringe, look to the hub, because you're not going to see it come back into the syringe if you are in a vascular bed. So even though I'm using a cannula, I can still be in a vascular bed. That does not give you, 100% safety. All right, so I'm pretty good with that. I see how I've already pulled that up on this side. Are you doing okay, Mitzi? Mm-hmm. All right, so she still has a little bit of submalar loss here, so I'm going to give her a little bit right there as well. Now I'm crossing one of her facial nerves, so she's going to have a little bit of an ouch as I'm going across that nerve. So if I could do this with wrestle and lift, or oftentimes I use define, wrestle and define for this. And the same effect is going to be fine for her. If she did not have as much If she did not have as much jowling down here, then I would probably switch over and use a wrestle and define. But because she does have that jowling, that wrestle and lift is my choice, because it's going to give you lift and projection and a little bit more support than just the define. But even with the lift, you see, you can't tell that she had something done. There's no product that you can see on the surface. That's really, really important. Okay, so I'm happy with what's going on with her lateral jawline. I'm now going to move to using the cannula now on her jaw. So, like I said, you find the middle of the jaw. Are you doing okay? Mm-hmm. So I try to mark out where her vessels are so that I don't cause excessive bruising. So this is where I'm going to go right into the middle of that jaw. Now, if I fold down like this and crease, this is a big area she's going to need some help on. She needs this to be popped out. So I'm going to do a little bit with the cannula, but I'm going to come back in with the needle as well. Okay. So little stick. So if I'm going this way, I'm going to move it this way. If I'm going to go this way, I'm going to turn it this way to give that entry point. I think I'm talking too much and not working fast enough, so it's closing off already. Okay, so important is that if you're going to be threading with a cannula on the jawline, you've got to be down to the mandible. You cannot thread above the mandible. You have to be down to the periosteum. So make sure you are really deep. You are deep. You should not be able to lift up and be able to even see that hub. If you don't, it's going to look like you have separation. So I'm pulling back, and now I'm going to give a little line of retrograde threading of this wrestle and lift. Okay, so not only did we build up the angle, but now we are now building up that mandible. Okay, so now I'm going back in, if I can, without sticking her again. Okay, and I'm deep. So I'm really, really deep. You see, I'm lifting up and you cannot see that I'm lifting up. So I'm all the way, my tip of my cannula is all the way to here. You should always know where the tip of your cannula is. Don't just blindly inject without knowing where you are. You're always on the anterior surface of the mandible. Don't go underneath the mandible. Don't do that. Okay, so I'm happy with that. Now, that little area that I told you that we need to address right here. Do you need another puff, Mitzi? Okay, so I don't want to do any bolusing here because her fossa's here. So I want to stay low on the mandible. So I'm going to come straight in. I'm on the periosteum and I'm pulling back. I'm aspirating. If your needle comes off of the mandible or the periosteum, you have to re-aspirate. And I'm normally bolusing about 0.5 to 1 for each injection point here. Okay, we're getting it. I need a little bit more on the cannula. Okay. And sometimes it takes 2 injection times to get exactly what you're trying to achieve. Go ahead and sit up now, Nancy. So, with her, go like this. So you see her platysmal band. Her platysmal band, as we get older, it comes up and forms over top of the jowl. So you're fighting the fact that we're losing volume and this is coming down, But in addition to that, the platysmal band is yanking it down. So we are going to have to put some Dysport here and do a Nefertiti lift to suck that little platysmal band down so it stops yanking on that jowl, or it's not going to completely be soft. But if you look on this side of her, we've gotten definitely jawline formation and much more tighter. I think she's going to need an entire other syringe more laterally just from here to here. So this took, so far I've done 2 wrestle and lift on her, but she's going to need another whole wrestle and lift. So I'm going to continue to build this up right through here to see if we can't pull this and make this tighter for her. The other thing I'm going to show you really quick, now that you've got the design, is how do you do this, the define in this chin. I'm not sure if we actually talked about this when we were training, but my entry point for her is going to be here, and I'm going to utilize that 22 gauge cannula and come all the way up like this and volumize her whole chin. It's going to lengthen her diameter from her lower lip all the way down to her chin. So that also is going to pull this down. She also needs Dysport into her mentalis. This mental area pulls back and retracts and causes this mental crease to be more, and that's all acting up down here, and that's what's causing that irregularity of her jawline. So it's not just a combination, or it's just not the filler issue and the jowls and all this, it's the extra muscle movement that we get as we age. So I'm going to show some before and after pictures as soon as I'm done with her, but if y'all have any questions, just text me or email me back, and happy jaw forming, and y'all take care.